When I was a small child, my father was diagnosed with rheumatoid arthritis, also known as RA. At first, the doctor did not recognize what it was and was treating for something else. This caused other side effects to his body. He became very ill and was unable to eat, and soon he began to lose mobility in his joints. The doctor then found his RA through a blood test. RA, if left untreated, can cause limited to no movement in the joints and cripple the patient. Once the doctor diagnosed the RA, they sent my father to a rheumatologist. There, they came up with a treatment plan to keep the disease from progressing. He has been going for intravenous treatments for every 6 to 8 weeks. Rheumatoid arthritis is an autoimmune disease and is the most common form of arthritis. It affects 1% of the population and is more common to women than men. RA commonly shows up in men and women ages 30 to 60. RA is treated totally different than other types of arthritis, such as the common osteoarthritis. It is important to recognize the symptoms and get the correct diagnosis to ensure the patient is properly treated. Throughout my speech, you will learn the signs and symptoms of rheumatoid arthritis, what the doctor will look for in a patient's blood test to properly diagnose the disease, and what is commonly used to treat the disease. Let's begin by looking at the signs and symptoms of rheumatoid arthritis. As I said before, RA is the most common form of arthritis. There are some genetic and environmental factors that contribute to the development of RA. The following are possible causes for the disease. Patients with RA may have a specific genetic defect which increases their chances for developing RA. Problems or defects in the autoimmune system may cause the immune cells to fail and recognize the tissues in their own body. An infection with certain viruses or bacteria that can cause abnormal immune response, chemical and/or hormonal imbalances in the patient's body. Women and people between the ages of 30 and 60 are at a higher risk for developing RA. You're at a higher risk if you have family members with RA. If you're a heavy or long-term smoker, you're at a higher risk. Next, we'll be talking about the signs and symptoms of RA. RA usually presents itself with joint symptoms that involve 2 or more joints, which are usually smaller joints on the same side of the body. Other symptoms include, but are not limited to, the following. First thing in the morning, after an activity lasting more than 30 minutes, joint and pain stiffness is increased. Red, warm, and swollen joints. If you look, you'll see the swollen in the wrist and the redness. Deformed and or misshapen joints. Other things RA can cause, and my dad suffers from at times, is very intense fatigue, decreased energy, muscle aches, decreased appetite, fever, sweats, insomnia, and small lumps or nodules under the skin near the joint. If you look on the pinky, you'll see the knot. We will continue by talking about diagnosing RA. RA can be difficult to diagnose just from observation, especially if symptoms have not been present for a long period of time. Possible tests the doctors may perform are a joint count, which includes counting both large and small joints that are swollen and red and how long they've been present. Blood tests, which look for the Rh factor, autoimmunity, and inflammation in the blood. Imaging tests, such as x-rays, MRI scans, and tissue samples. Finally, let's talk about living with the disease and possible treatments. There is no cure for RA, and the goal of treatment is to slow down the damage of RA, reduce inflammation, relieve pain, and improve the ability to function on a daily basis. There are a variety of medicines and treatments used alone and in combination to treat the disease. Some of them may include the following: non-steroidal anti-inflammatory drugs to be taken by mouth or applied to the skin. These can include ibuprofen, cyclooxygenates 2, or COX-2 inhibitors. Disease-modifying anti-rheumatic drugs, which are taken by mouth or injected in the skin. One example is methotrexate. Because of a misdiagnosis early in my dad's treatment, he suffered from other side effects, which limits the variety of treatment he can have. He's given a type of chemo called Remicade. It is given intravenously every 6 to 8 weeks. In addition to the Remicade, he takes steroids. The steroids are increased when he has a major flare-up. In addition to medications, limited but frequent exercise such as walking is encouraged. Throughout my speech, I have covered a variety of facts concerning the identification of symptoms and the treatments for RA. We have talked about the signs, symptoms, treatment, and exercise for RA. Now that you know what to look for, you should be able to recognize the symptoms of RA if you or your family member were to begin having symptoms.